A linear array transducer with a nerve exam type is used to perform an ultrasound-guided infraclavicular regional nerve block. The target depth is approximately 3 to 4 centimeters in an 80-kilogram adult. The patient is positioned supine with the arm abducted 90 degrees and the elbow bent 90 degrees to move the clavicle posterior and permit a shallow angle of needle insertion. The patient's head should be rotated toward the contralateral side. The transducer is placed on the chest in a paramedian plane inferior to the midpoint of the clavicle, with the orientation marker directed to the patient's head. The axillary artery is seen as a dark, round pulsatile structure with a hyperechoic wall inferior to the pectoralis major and minor muscles. The axillary vein lies beside the axillary artery and collapses with compression. The nerve cords appear as hyperechoic circles with a honeycomb appearance within the bright hyperechoic fascia of the brachial plexus. The transducer is slowly moved in a lateral direction following the course of the axillary artery. The nerves will split into a lateral, medial, and posterior cord. The optimum position of the transducer for the infraclavicular nerve block is as lateral as possible. The needle is positioned 2 centimeters cephalad to the transducer and advanced using an in-plane technique. The needle path is directed over the clavicle and through the pectoral muscles. The initial endpoint for the needle is immediately posterior to the midpoint of the artery. The spread of local anesthetic should be observed. Supplemental injections can be made anterior to the artery to deposit local anesthetic around the lateral and medial cords if required.